Hello, welcome to this video. My name is Nikki Cooley, and today I will be talking about individuals with intellectual disability, a special population that is more prone to receive abuse in the healthcare industry. What is intellectual disability? Society often associates intellectual disability with individuals who do not have the ability to think and act for themselves and overall are incompetent in life. This, however, is false, as most individuals with intellectual disability can and wish to think for themselves and be as independent as possible. Intellectual disability is defined as a disability characterized by significant limitations in both intellectual function and adaptive behavior. The individual must have an IQ of less than 70 to 75, and the disability must be present before the age of 18. Intellectual disability can be caused by genetic variations that results in conditions like Down syndrome and Fragile X, incorrect development during pregnancy, complications during birth, and exposure to diseases or toxins, and can range from a low severity to high severity. Individuals can be anywhere on the spectrum of intellectual disability without any set boundaries. Approximately 200 million people worldwide are diagnosed with some form of intellectual disability, with the most prevalence in low-income countries. Abuse or mistreatment can come in two forms, physical and non-physical. In each of those categories, there are many different subtypes. The most common type of physical abuse that people with intellectual disability face in healthcare is sexual abuse and neglect. As far as non-physical mistreatment, patients with intellectual disability can suffer from emotional abuse or experience a loss of autonomy. Individuals with intellectual disability are more sexually vulnerable due to their poor understanding of inappropriate behaviors and problems with reporting sexual abuse. The vulnerabilities within the disability make it easier for healthcare workers, or anyone really, to exploit those with intellectual disability. Those who have less severe disability may realize that they are being assaulted, but do not know it's illegal and that they have a right to say no and report it. Due to threats to their well-being by their abuser, they may never tell anyone about the abuse, especially if committed by an authority figure whom they have learned not to question, like healthcare staff. Neglect is another type of physical abuse, though it may not be as direct. It is the most common type of abuse towards people with intellectual disability in the healthcare setting. Neglect is a broad term that encompasses carelessness. This includes giving little to no attention to the person, disregarding their duties, and failing to fulfill the needs of the patient. The most common type of neglect in healthcare is physicians and other staff not taking the time to accurately assess the individual needs of the patient. It can be hard for many people, including hospital staff, to visually recognize if an individual has an intellectual disability. Not knowing that a patient requires specific supports has the potential to cause physical harm. In a study done by Afia Ali, one participant's mother recalled that the hospital staff had not explained how to complete the food menus, so when dinner came, all that her son had to eat was similar to a slice of toast. Patients do not have to be physically harmed to be mistreated or abused, especially in healthcare. One type of non-physical mistreatment towards people with intellectual disability is emotional abuse. It is defined as any act including confinement, isolation, verbal assault, humiliation, intimidation, infantilization, or any other treatment which may diminish the sense of identity, dignity, and self-worth of an individual. In the study by Ali that I mentioned earlier, another patient reported an instance of infantilization, describing doctors and other medical staff coming into the room only for seconds and talking to the person with an intellectual disability as if they were 5 years old. Additionally, the way healthcare staff speaks to people with intellectual disabilities can be considered emotional abuse. In the same study, one grandson notices the difference in how the medical staff spoke to his grandmother versus how the staff spoke to him. All of these actions, as well as those not reported, can diminish one's sense of identity, dignity, and self-worth as they are not being seen as a human being and the adult they are. Another aspect of non-physical mistreatment is taking away an individual's autonomy or the freedom to make choices for oneself. There are several ways to restrict autonomy, such as not addressing the patient directly during care and not involving the patient with intellectual disability in their healthcare plan. A study in Australia reported that patients with intellectual disability are significantly less likely to receive direct care compared to encounters of people without intellectual disability. Giving indirect care or not addressing the patient directly can lead to serious consequences because it does not give the patient the opportunity to relay pertinent information about their medical history. For example, patient 9 in Ali's study describes an event where his physician did not explain to him that they were giving him an epidural. Because he was not addressed directly, he could not voice his concerns and tell the physician that he had problems with his legs and did not want them to go numb. This is a mild example, but there are more serious cases where allergies and other serious factors are not discussed, which turns this lack of autonomy and patient involvement into potential physical mistreatment. Besides the concern for immediate harm, the mistreatment of people with intellectual disabilities affects the future of their health. Regardless if they have a disability or not, people who are mistreated at a healthcare facility are less likely to go back. However, this is a concern for people with intellectual disabilities because they may now associate mistreatment with any and all healthcare facilities. This tendency may have dangerous consequences because people with intellectual disabilities disproportionately have more health problems and often require more medical attention than people without disabilities. Not wanting to seek even routine medical care puts the patient at risk for further complications. What are some ways we can prevent the physical and non-physical mistreatment of those with intellectual disability in healthcare? Also, do you think the goals that Stephen Klasko introduced in What Healthcare Will Look Like in 2020 would help those with intellectual disability? Why or why not?